Imagine juggling not just one, but several health challenges at once. How do patients and providers keep up? Today, we're diving into the world of multiple chronic conditions with Dr. Kim Kubler, editor in chief of the Multiple Chronic Conditions Resource Center. Dr. Kubler is a leading voice in palliative care and healthcare innovation, and she's here to share why collaboration, policy know how, and evidence based care are game changers for anyone navigating complex health issues. Today, we are sitting down with Kim Keebler, editor in chief of the Multiple Chronic Conditions Resource Center. Welcome, Kim. Glad to have you
Thank
here.
you. I appreciate it, Scott, for the invitation.
Yes, absolutely. You've been in healthcare for 4 decades and founded the Multiple Chronic Conditions Resource Center. What led you to focus specifically on multiple chronic conditions, and why should health entrepreneurs pay attention to this patient population?
Well, that's an important question, and I can't believe I've been practicing for 4 decades. But while attending doctoral studies at Vanderbilt in 2010, just before the Affordable Care Act was released, the Senate Finance Committee, under bipartisan leadership of Republican Senator Johnny Isakson of Georgia and Democratic Senator Ron Wyden of Oregon, released a call for stakeholders on multiple chronic conditions. I read about that. I submitted testimony. And after that, I became a stakeholder for the multiple chronic conditions initiatives through the federal government. When the Affordable Care Act was released, chronic disease was one of the anchors in this legislation. And my research has focused on symptom management in chronic conditions, particularly in preventing disease exacerbations in heart failure and chronic obstructive pulmonary disease, the most expensive conditions in the country due to frequent use of hospitalization. Currently, 1 out of 3 adult Americans have multiple chronic conditions, and for persons 65 and older, 4 to 5 Medicare beneficiaries and a growing number of children have multiple chronic conditions. This is the largest patient population in the United States and users of healthcare resources, accounting for 64% of all clinician visits, 70% of all inpatient stays, 83% of all prescriptions, and 71% of all healthcare spending. 93% of this occurs in Medicare spending. So you can see that this is a large patient population with a lot of complex care needs.
Okay. You had talked before about palliative care is often misunderstood as just end of life care. How would you redefine palliative care for our audience, and what business opportunities exist in proper system management?
Thank you. I have spent a lot of my career trying to push palliative care away from the hospice movement. The U.S. hospice movement has unfortunately defined palliative care in the United States. It isn't the same in other countries. I am the first author of a recent consensus publication on integrating palliative care in the management of multiple chronic conditions. This was a consensus statement with policy implications, and it was published by the American Academy of Nursing last fall. This paper supports the paradigm shift of moving palliative care back into the primary care setting. And this is also supported by the World Health Organization, the American Medical Association. They have all involved in initiatives and publications that show the need for palliative care in the primary care setting. Palliative care is symptom management, especially in patients with multiple chronic conditions. The focus is on quality of life and not on death. Palliative care can be integrated into the routine management of chronic diseases such as heart failure, COPD, cancer, chronic kidney disease, and others. The effective management of symptoms prevents worsening of a disease, reduces hospitalization, helps patients to maintain physical functioning, which is the number one indicator of quality of life.
Your resource center has been recognized as a premier source of clinical information. What key resources does it provide that health and wellness entrepreneurs could leverage?
Thank you for recognizing the Resource Center. We provide ongoing updates on health policy and clinical practice for this, as I mentioned, complex patient population. We provide ongoing podcasts, We offer all the most current guidelines and chronic conditions. We also offer credible patient resources. I mean, you can get on YouTube and find all kinds of unsupported scientific resources for patients and families, but our website or our resource center offers real credible resources for patients to make informed decisions. We also do blogs and monthly newsletters. We have about 23,000 followers on our newsletter right now. We just completed a webinar that was sponsored by Walgreens, a special pharmacy, on person-centered care planning for the oncology patient, and soon to embark on another Walgreens initiative on patients with GI conditions. The Multiple Chronic Conditions Resource Center is held under HealthCom Media, which is the official journal of the American Nurses Association. And through our uptake with our podcasts and where we are held within the HealthCom media, we have access to over 4 million nurses.
Wow. You've worked extensively with state and federal health policy leaders. What current policy trends should health entrepreneurs be aware of that might impact their businesses?
Yeah, I think this is probably an interesting question, particularly in the light of all that is happening in legislation. But I think it's important for our audience to know, and clinicians, that policy drives practice. And as much as we hate to think about that, policy in the United States determines reimbursement, and we are a reimbursement driven healthcare system. So being aware of certain policy will help to strengthen anybody's business, knowing what's coming down the pike and what to expect. I recently completed grant reviews for the Patient-Centered Outcomes Research Institute that was primarily focused on prevalent chronic conditions. I reviewed, I think, 3 or 4 grants specifically focused on heart failure and some of the newer medications in combination with diabetes and obesity. Last month, I attended the Agency for Healthcare Research and Quality Summit as an invited member of the Person-Centered Care Planning for persons with multiple chronic conditions or at risk for multiple chronic conditions, and the push at the federal level to focus on person-centered care, which is patients' quality of life and what matters most to them, versus patient-centered care, which is usually between the provider and the patient, where person-centered care is everyone, the individual patient, the family, and all members of the care team.
Okay. How can health and wellness businesses better collaborate across disciplines to improve care for patients with multiple chronic conditions?
Yeah, I always say that taking care of a patient is a village, right? We heard that a long time ago, that it takes a village to take care of a child or to raise a child, but it also takes a team to take care of a patient. If you think just about pain itself, I mean, you have the patient, obviously, but you have a physician, a nurse, you could have a social worker, there could be a spiritual advisor, pharmacy, physical therapy, chiropractor, and the list goes on. So practicing an interdisciplinary practice with a focus on physical functioning in this patient population is really important. The more that a patient is able to care for themselves and fulfill their activities of daily living, the better quality of life they're going to have. I practice interdisciplinary practice. I have orthopedic surgeon, I have physical therapy, I have chiropractors, nurses, medical assistants. I use MRI, X-rays. So I use the whole team to manage the care of my patients as well.
You've authored award-winning textbooks focusing on clinical management. What knowledge gaps do you see in how practitioners are trained, and how might entrepreneurs address these gaps?
That's also a really important question. I do a lot of writing for the American Nurses Association Journal, the American Nurse Journal, on pharmaceutical products and different types of classes of medications. Especially in the news in the past few years, we saw where nurses gave patients the wrong medication, the wrong drug. So I really think it's important that we, even if we're not dispensing or writing the prescription, to understand the classes of medications and adverse events that can arise from drug-drug interactions. I'm not sure if you've seen any of the American Medical Association papers that have recently been published and highlighted in the Bloomberg series about concerns about nurse practitioner clinical training, especially online training. They cite that the lack of standardization and the fact that nurse practitioners train approximately 500 to 750 hours of patient care versus medicine. They train almost 12,000 to 16,000 hours. I have done 3 research studies that have all been published evaluating nursing perceived knowledge versus actual knowledge on symptom management and common chronic conditions. And all 3 of these research groups did not pass the standard objective question or a standard objective test series that we offered. But it was focused on using guidelines and standard recommendations. And we studied undergraduate nurses, bachelor degree nurses in their final semester of their studies. We looked at master's students, both DNP, Doctor of Nursing Practice students, and nurse practitioner students. And then we also queried graduate nurse faculty that are training nurse practitioners. Findings of these studies was a little startling, and we recently, the authors of these studies, had some communication with the president of the American Medical Association, who also was a little concerned about some of the findings and the work that Bloomberg is highlighting. So I think there's a lot of opportunity to improve clinical practice, understanding guidelines, implementation to ensure standardization and safe practices, and particularly in pharmaceutical education.
How can health and wellness businesses better incorporate evidence-based guidelines into their practices while maintaining personalized care?
Well, when you use the term business, I'm not sure if, you're looking at for profit, not for profit, but anytime that you're thinking about patient safety, evidence based guidelines can help to support that. If anyone is ever sued for a medical liability, the guidelines are used to gauge whether or not that person was implementing standard of care. It's important to know too that, evidence-based guidelines include randomized controlled trials, systematic reviews, and also expert opinion. But we also have to pay attention to the patient. Sometimes even in the best guidelines, it may not be appropriate for that patient. So personalizing care should always come first, what is best for that patient. And again, that is person-centered care. And then understanding that the guidelines can help to direct the clinical decision making.
So, looking ahead, how do you envision the future of multiple chronic condition management evolving, and how can forward-thinking entrepreneurs position themselves for success?
Well, I think we can just look at what's happening in the HHS, Health and Human Services, and our new director of HHS. His focus is on chronic conditions and primarily prevention. If you think about where we've been and what we've been doing, we've been treating it. We've been, trying to manage it, trying to keep patients out of hospital. But if we can prevent the prevalence of chronic diseases, I think that's key. And what's interesting to see how some of the studies are being discontinued. The women's health study was just discontinued, which has been ongoing for years and years and years. Obesity studies have been discontinued. So again, paying attention to what's happening at HHS, what the focus is, what they're doing, and where that direction can take. I think anyone who's following that can understand how to gauge their business or what direction patient care is taking.
Okay. Thank you for your insights, Kim. I appreciate this. Tell the audience how they can find you.
Yeah, absolutely. So the Multiple Chronic Conditions Resource Center is www.multiplechronic-conditions. You can also find our podcasts on YouTube. I know it's on all the other platforms that I forget the names of, but HealthCom Media, the American Nurse Journal, we are linked to them. So you can find that on YouTube as well.
Excellent. Thank you so much.
And LinkedIn, we post a lot on LinkedIn as well. So you can look for me on LinkedIn and stay current with guidelines. And it's interesting, how you can track who's looking at what posts. And it seems like the guidelines and new drug developments are always the hottest topics for the most hits.
Okay. All right.
Thanks for tuning in to this episode of The Wellness Growth Show. If today's conversation sparked something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.